I'm Dave Mungo. I'm an orthopedic surgeon at Alliance Community Hospital. I've been practicing orthopedics here for about 12 years. Originally from the Northeast Ohio area. I did all my training in upstate New York in Rochester. And I've been here in Alliance ever since I finished my training. A lot of people don't know what an orthopedic surgeon does. We're the physicians that treat the musculoskeletal system, the bones, the joints, the muscles, the tendons. Commonly we treat everything from the shoulders on down to the hips on down. There are orthopedic surgeons that take care of spine problems also, but those doctors tend to be specialized just in spine surgery. We will treat a lot of the joint problems that people commonly experience, joint pains, muscle aches. Obviously, if you break a bone, it's pretty obvious. There's more subtle signs that can be clues that you might need to see somebody like myself. Knowing when the weather's changing, that aching you get in your joints, worse at the end of the day, like a toothache type pain in your joints. It can be in the hips and the knees and the shoulders. Worse with activity. Those are the kind of problems that we'll look for and are good clues that there might be something going on inside your joint. There are things, though, that in our everyday lifestyles and habits that do contribute. Smoking is certainly one of the biggest things. People tend to associate smoking with bad lungs. The reality is it's extremely bad for your bones. It causes osteoporosis, it causes back and neck problems. It's just generally a very bad thing. The other common problem that we suffer in this country is lack of activity. We don't need to go out and hunt and chase down our food anymore. We don't need to split firewood. There's a McDonald's on every corner. Unfortunately, we have at least 50% of this country that's overweight and obese, and it's taking its toll on its joints. I commonly will tell patients to think of their joint cartilage as the tread on a tire. Now, everybody's certainly born with a different quality of their tires, but how you treat your tires makes a big difference. Do you keep them inflated and balanced and work them right? And that's what exercise does. And the other factor is the weight on your tires. If you have sandbags in your trunk for extra traction at wintertime, that extra weight on your tires is going to make them wear out much faster. Most people in Northeast Ohio do not get enough sunlight to make enough vitamin D, myself included. I had mine tested recently and was surprised to see I was actually low in vitamin D, and I have to take it as a supplement. And I'm somebody who exercises 6 days a week, and yet still don't get enough vitamin D. And most people don't have enough calcium in their diet either. Not only the older people, particularly women when they go through menopause, we're also appreciating that most kids and teenagers, when they're going through the growth spurts, do not have enough calcium and vitamin D in their diet, and really need supplementation. Most common things that we'll do surgical-wise are hip and knee replacements. Myself, I do a lot of partial knee replacements. We've become one of the leaders actually in all of Northeast Ohio for the Oxford partial knee replacement. Very successful partial knee replacement, has 20-year data that's absolutely fantastic. We do a fair amount of hip replacements, shoulder surgery, rotator cuff surgery, and then a lot of knee arthroscopy and sports medicine related injuries also. I do have a partner now also. Dr. Nietzsche is here and has been on board for about a year and a half. And so with Dr. Nietzsche, we're now able to try and get people in within a couple days. We try and get people in as quickly as possible. We do prioritize based on the severity of the injuries. Try and get you as quickly as possible and get people taken care of as best we can.